This is Salma Schimmel for Vital Options and the group room at ASCO in Chicago. We welcome now Dr. Joanne Mortimer, Director of the Women's Cancer Program at the City of Hope Comprehensive Cancer Center in Duarte, California. Hi, Dr. Mortimer.
Hi, Selma.
What are you working on personally?
What I presented at this meeting was actually along this line of trying to avoid getting tissue and finding out what's going on. We developed a radio-labeled Herceptin, so a Herceptin, a trastuzumab that has a radiation label on it so that we can use it as a PET imaging agent. And so I presented the data on our first part of the study showing that we could actually demonstrate by PET where the HER2 positive breast cancer was.
Wow.
And now where we need to go is figuring out how this relates to, will it predict for effectiveness of Herceptin therapy? Because we don't give Herceptin alone, it would be a very important thing to know.
How do you analyze this?
So it turns out that the normal body actually has a lot of tissues that have HER2 on it. And so what we do before we inject the tracer is we give a small dose of Herceptin and then we give the tracer. So the small dose.
You still give the glucose?
No, so this is instead of glucose. So it's instead of doing a glucose scan, you get Herceptin with a label on it.
Would you have to know ahead of time the patient's HER2 positive before you would?
Yeah, that's absolutely correct. And all the women that we imaged so far, we did biopsies to know for sure that their cancer had not changed. We actually, 3 women that started out HER2 positive, when their cancer came back, turned out to be HER2 negative. But the patients on this study were all biopsy confirmed HER2 positive.
The reason the cell would uptake the HER2 then would be because?
Because presumably because it binds to the Herceptin. So it's telling us that the Herceptin's going to that HER2 and binding onto that tissue. And so what we've seen so far is pretty incredible images that we can document HER2 positive breast cancer, which seems to be every bit as good as conventional PET with glucose. But what's important about this is, we don't want to replace using glucose. What we're trying to do is figure out more about how Herceptin is handled by cancer cells. Friday, 3 days ago, we imaged our first patient whose cancer was not HER2 positive. Her cancer was HER2 2+, but negative by FISH. There's some data that maybe women who are not HER2 positive by definition may benefit from Herceptin. And so what we're doing now is imaging women who are not HER2 positive, and it turned out that her tumor did uptake Herceptin. It took it up in a little less than the women who are strongly positive. So moving forward, we may need to consider using Herceptin in these women.
This is rather innovative research.
Yeah, it is. It is relatively innovative. We actually developed this molecule at City of Hope, and we have the IND for this product. And the study was actually funded by the Department of Defense, who I'm eternally grateful to for funding it because it really is pretty innovative.
The concept of this technology using a therapeutic agent to see if there's a sensitivity and uptake, could this be applied to other cancers in imaging?
Very definitely. The beauty of PET, the technology itself, is that you put a radiation particle on something that you want to know the function of. So, we always use glucose because cancers, they turn over faster, so glucose is picked up by them. It gets trapped in the cell, so we can see where cancer is, but it doesn't actually help us understand the cancer. But we've used PET to look at cancers that are estrogen fed. So using an estrogen with a tag on it, we can show the cancers are fed by estrogen. And at least in a study that we did several years ago, unless your cancer was picked up estrogen, you weren't likely to respond to a hormone therapy. And so sort of taking off from that, we're hoping that we can develop this trastuzumab, this Herceptin image, as a way of predicting who may ultimately benefit from Herceptin and who won't. Because Herceptin, it has some ups and downsides. It has toxicity and costs that are pretty meaningful. And so if we could ferret out who was going to benefit and who wasn't, similar, there may be a whole population of women whose cancers are read by pathologists as being negative, but who may benefit from Herceptin that we may identify.
And is the tag, when you talk about the tag, is that the Herceptin or is the tag the radioactive element?
Yeah, it's just a radiation tag on top of Herceptin. So we're actually injecting a Herceptin with a particle on it that basically just goes right to the tumor that has the HER2 positive cells.
And this is a City of Hope development?
It is the City of
Yeah,
Hope
and
development,
who
yeah.
thought of this?
So it's a whole, there's a whole team of us putting this together. I was responsible for putting the clinical trial together, which is the least complex, but it's our radiochemists and our radiation oncologists who developed it.
What's the next process in development? Now you have discovered this. What happens subsequent?
So I think there are two avenues that we're probably going to take with this. So we're looking at women who are not HER2 positive to see if maybe there are women who might benefit from Herceptin who aren't getting Herceptin. So that's one avenue. Another avenue is we don't actually know how Herceptin works. If somebody has a large bulk of cancer, let's say they have 2 pounds of cancer, they get the same dose of Herceptin as somebody who's got 2 ounces of cancer. Do you really need that much Herceptin to kill the cancer? And so, one thing that we've discussed doing is using this imaging to look at, when we give Herceptin, is the dose very high in people who have a small amount of tumor and very low in women who have a lot of tumor, because it may be that we're not giving enough Herceptin in people with a lot of tumor, and maybe we're giving too much in people who have small burdens of tumor. And then the third avenue is to put something that's going to kill cancer on this label so that we know that we can go and it'll go to the cancer. If we can have it go to the cancer and deliver radiation, we can kill it.
Remarkable work.
Yeah, thank you.
Thank you, Dr. Joanne Mortimer, Director of the Women's Cancer Program, City of Hope Comprehensive Cancer Center in Southern California.
Thank you. Thank you, Selma.